When I think about Seattle's LGBTQ Center, I think about actually myself. I grew up in a space that there weren't queer spaces to be had.
I moved to Seattle in 2019. And when I first moved here, I was obviously in desperate need in finding community.
I think that we provide a safe space for queer community, but I also want to reiterate that we're not just for queer community.
Center provides such a unique space to not only create a place of safety, a place where you can talk about who you are without judgment.
There is a spirit of wanting to help people here and wanting to do everything we can to get them what they deserve.
The program side of the house, the health services side, we're really thinking how we can be intentional and make a space that is not only low barrier and accessible to people, but then also really inclusive and welcoming when people are actually here.
Services that we provide, whether that's youth advocacy and the youth that we support, whether it's our mutual aid closet to help the community or our HIV and STI testing, I think it's all very unique in this specific space.
When I created the library, I wanted to center the cutie BIPOC people, so I started putting out into the world and our donors and people who see our website. These are some books that are really great by queer, Black, Indigenous, people of color.
My favorite thing about the youth programs that we offer is the sense of community that we're able to bring for the youth. For our mentorship program recently, for example, after just our first orientation, some of the mentees were like, I have never felt so seen and welcomed in a space ever in my life. For some of them specifically, they were like, I don't think I've ever met this many multiracial queer people. I don't think I've ever seen so many of us in one room before.
We are teaching these young people skills that they may already have, but bolstering them, giving them awareness of these systems so that they can better navigate them, helping them understand how to make a goals and action plan.
The organization is built to support our most marginalized, and then we can really navigate what are those needs, concerns that we can then address next, right? So if we are focusing on the ways that our communities need to navigate just like the world in access to food, in access to resources, in access to community space, we can sort of address what comes next, right?
So finally, after so many years, there's been this push to have these services more and more available in these areas where people who have been pushed out, gentrification, because they cannot afford here where they live. So now a lot of BIPOC communities of color live in that area. And that's why we decided to partner logically with a large clinic like CMAR to be able to bring testing, STI testing, PrEP, healthcare navigation, advocacy, and other things to them bilingually, biculturally, in a place that is trusted.
Movements impact all of us. Viruses and diseases impact all of us. Just because we can't see that impact doesn't mean it's not there. Just because somebody hasn't told us doesn't mean it doesn't exist.
Growing our feedback loop with community so that we are better creating programs that are what folks are asking for and needing and stating that they need. Having and building the ability for communities to self-determine what resources are best fit for them will allow us the ability to best serve.
When someone is looking for a resource, they just have to need to call the center. You'll probably get me or a volunteer that's working up at the front desk, and we literally, what we call in the library world, a reference interview. And with that reference interview is what we're really trying to do is pinpoint exactly what you need and what you're actually looking for.
We are really unique in that most of the work that we do here happens out in the community. We are not, we don't ask people to come to the center necessarily to get the access to resources or do syringe exchange or things like that. Instead, we go to where people are out in the community.
We're able to do a lot of on-site problem solving together for folks to get them access to healthcare, whether that's prep care, or whether that's just figuring out how to get the cost of their medication covered, how to get their correct name on their prescription, stuff like that. We're able to be really versatile and problem solve with our partners at the center.
It is filled with so many people who genuinely care and work so hard in supporting the community that they are a part of.
Everyone is on the same team of doing everything we can to help people.
Just hope for happiness. I hope that people find their happiness and are able to live in their truth.
Without those donations, without that additional support, we wouldn't be able to do everything that we're currently able to. It allows us the flexibility that we need. It really allows us to just do what we need to do. So, could not be more grateful for that.